Hello, everybody. Welcome to another episode of What's Next After BDS. And today I have with me Dr. Dharshini, an old friend of mine. She also completed her BDS from India. Dharshini, can you give a short intro about yourself?
My name is Dharshini. I did my BDS in Meenakshi Dental College, Chennai, and I graduated in 2015. And then I came back to Malaysia and worked here for 2 years, and then applied for my master's in orthodontics at UCL, London, and did my membership in orthodontics right after that, graduated in September 2021. So now I'm back in Malaysia working as an orthodontist in a private practice.
Okay, that's nice. Now, the usual, knowledge or general awareness among people, including me, is that if you want to do masters in the UK or even consider working in the UK, as far as dentistry is concerned, if you're going to do something related to non-clinical MPH, that's a different scenario. If you're going to do something related to your dental, you have to clear the ORE exams, right? So did you have to clear the ORE exams in order to get into your masters? So what is the process? I just want to know the process.
The OREs to do a master's there. So your OREs are needed if you want to register with the Dental Council in the UK and practice there as a dentist. But if you are looking to just do a master's program and return to your home country, then you don't need your OREs. So what I needed to do was, so apart from the usual, letters of recommendation, your statement of process, regular documentation and all that, was just have 2 years of work experience. And then I had to complete my TOEFL, either TOEFL or IELTS, either is accepted. And yeah, that's about it. Look at your undergrad transcripts and that's it, really. Nothing else, yeah.
Okay, so does your BDS marks matter a lot? I'm sure a lot of people are going to ask me this question. Your marks secured from first year to final year, does it matter a lot?
I mean, to be honest, I don't know how much they mattered. All I know is I had to submit them. Okay. And then I go for an interview. So I'm guessing they do matter, but I don't know. It's not like I was some star student in undergrad. I did have to do to just get through. So I think if your marks are decent, you'll be fine. I did have decent marks in ortho in my final exams. So I don't know if that helped. But I think as long as they're decent, it should be okay.
Okay. So this master's, what is the degree exactly? How is it?
So it's called the MClinDent. So it's basically master's in clinical dentistry. And I did orthodontics. So it was at the Eastman Dental Institute, which is under UCL.
Okay. So you have to, once you, for how many years is this degree?
So because I did the advanced training where at the end of your master's, you do the MORTH as well. Mine was a 3-year program, but there's also just 2 years where you just get the MClinDent, but you don't do the MORTH. So you have the option of choosing whichever.
But if you finish MClinDent, you can't practice in the UK if you are from a foreign country, right? You can use it only to practice in your own country.
Yes, correct. Because
to practice your specialty in your own country, but not in the UK.
Yeah, that's right.
And you had an option of choosing orthodontics, or how does that work? You have to select a particular specialty, or you have to choose your specialty, right?
Yeah. So I applied for the orthodontic program.
Is it like only you can apply only for ortho, or you can simultaneously apply for other specialties and you have an option or something like that?
I think you can apply to more than one because the departments do function, separately. Okay. So you can apply more than one and see, where you get called. That shouldn't be a problem. But I only applied for the ortho program.
Because you're very clear that you wanted to do only ortho, right?
That's right. Yeah.
Okay. So once you've joined this course, so how does this course function? Like compared to as far as the Indian orthodontics PG is concerned, it's the same as you mentioned, 3 years course where they start with first preclinicals, then they have patients work, then they have a thesis, they have a dissertation, then they have some LDs to do, And how different is it from the Indian scenario?
Okay, so I wouldn't know how the Indian postgraduate program is, but very similar, I think, from what you've mentioned now. So let's start off with just, your lab work, right? So you do a lot of wire bending. They teach you about bonding on typodons, so you do that first. And then maybe after a month, they let you start with patients and you're supervised, for like with every step. So you have consultants and supervisors around. So you have to report to them. And that's the case throughout the year. You are always being supervised. But yeah, you start seeing patients after a month itself in your first year. And at the end of your second year, you have to submit your dissertation.
Okay.
And each year you have, end of the year exams, which you'll have to pass to go into the next year.
Okay. Nice. So you had a good time treating patients. I'm sure the way you approach patients was also different, right? Everything goes according to the UK guidelines and all.
Correct. Yeah. They really, really teach you, they stress so much on your communication skills and, the way you present, the way you explain things to patient, using layman terms and things like that. So you pick up all those things, during the program, which is very useful because you need to do that on a day-to-day basis.
Any patient who wants to take ortho treatment, obviously will have a lot of questions and curiosities in their mind, right, before taking the treatment.
Especially when you deal with children, right? Parents are always paranoid. They have 101 questions if they've seen Google or YouTube videos. So you need to be able to calm them down, but at the same time, clearly explain what is it that they need and what you're going to do. So yeah, I mean, it's very interesting. There's so much you learn from all this.
Okay. And what is the fee structure for those 3 years?
What do you mean structure?
Fee structure. How much?
Oh,
fee structure.
Yeah, sorry.
Fee structure. Sorry.
Yeah, so it depends on the program, the university. So the program I applied to, I think it was about £45,000 per year. So that's inclusive of everything course related, no additional fee. The MORT, however, was separate. So when you sit for the MORT, you need to separately pay for the part one. That's not included in your.
Correct. That's optional also, right?
That's optional. Yeah.
Exactly. Okay.
Yeah.
And
so
please.
Country, yeah, because some countries I know the MORT is compulsory. Some countries it's not. So I think just you need to make sure, depending on where you're from, if you need the MORT or not. Yeah.
It was really a good thing that I know that someone can do directly a master's program in the UK and come back to their native country and practice. This is such a nice thing to know, and it's recognized in India also, right?
It is. Yeah.
What are the other specialities available in how do you call it? MClinDent.
Dent. So I know they have perio, they have pedo, they have cross. I think so. There's oral surgery as well, but I don't know if it's MClinDent or if the title changes slightly. But I would say the program structure is more or less the same. It's about years, and even other specialities have these diploma exams that they can take at the end with the Royal College. So that's again optional if you want to do that or not. So I'd say definitely double check all this because I'm not 100% sure about the other specialties, but I know they are that.
I'll do the homework. Thank you for giving me a good start about this. So is there anything else you want to add on to this?
No, unless, if you have any further questions.
Suppose, say I finished my master's, say I'm your batchmate, and now I want to work in UK. So is there any license exam I have to write, or I have to again go through the ORE process, even though I finished my master's in ortho?
unfortunately, you need to do the OREs.
ORE again.
Because, yeah, so the thing is, they look at your undergrad degree, and if your undergrad degree is not recognized in the UK, then you can't get registered without the OREs.
Okay.
So I think the universities from India are recognized. So if you happen to, from one of those unis, then you're sorted. But otherwise, the OREs is the only way.
Okay.
Yeah.
That's a good thing.
I think
as well as a bad thing.
Sorry?
It's like a double-edged sword, right? You have to come back, or it depends upon your choice as to what you want to do.
Yeah, exactly. Yeah, it's a long process, but I mean, if you have reasons to be moving to the UK, then it's worth it. But if you want to come home country, then there's no need to worry about additional exams. Because in the US, that's the case, right? You need your NBE and the GRE sometimes to be able to.
Can you practice in the US with your degree?
I'm not too sure. I don't think I can. I'll probably have to do the license exams in the to be able to practice my degree.
Okay.
Because I think all these places, they look at your undergrad. They don't really look at your master's.
That's what I tell all of my students. See, if you have plans of going abroad, I think you should go immediately after your 12th grade, right? You shouldn't start your dental school in India and then go abroad, right? If your plans are abroad, make sure you start it even after you finish your 12th grade. Your job becomes simpler.
So much more easier. No, I see students doing their undergrad in the UK, and I'm just like, I wish I did that. It would have been so much more straightforward.
Absolutely.
But that's great advice, really, for whoever is planning to take that step forward. Better to start your undergrad abroad, whichever country you're planning to go to. Yeah.
So congrats on your M Ortho, and thank you so much for spending your time for us. And it's okay if I can share your email ID at the end of this, so that if people want to ask some queries or something, they can reach out to you.
Absolutely. That's fine. Yeah. No problem.
Thank you so much, Dharshini. Wishing you the best for all your future endeavors.
Thank you so much. Good luck to you too.
Yeah. Thank you. Bye.
Bye.